Dr. Saunders, tell me about your medical training, your background, how you became a doctor, and how you got to be here in where you are today.
Well, I went to Brigham Young University for undergraduate and had a degree in microbiology and chemistry and Spanish. And it was really good to have a microbiology degree because that's one of the things that we didn't learn a lot of in medical school. Then I went to UCLA Medical School and did 4 years there, and then after that did a family practice residency at Northridge Hospital in Los Angeles. The family practice residency, we do everything. We do deliver babies. I delivered about 200 babies. We do women, men, children, adults, older people. We learned the entire family, the spectrum of medicine. And that's really what I wanted, is the overall broad view.
And that's a pretty common path for an MD, right? To do that
yes.
General area of practice.
Yes, it is. Less so now. Doctors are more wanting to specialize. And so a lot of the family practice residencies have a hard time filling all of their spots because the doctors graduating from medical school want to go into a specialty like surgery or internal medicine or cardiology, those kinds of things. There aren't a lot who want to do general family practice medicine. So after I finished that, I started working for the county in Santa Barbara County Medical Clinic, and doing general, the same stuff I was trained to do. And over time, I began to see that some of the things that I was prescribing and doing were not helpful and sometimes did more harm than good. So I was being a little more judicious about using medications. And then I opened my own practice in Buellton. And as I would meet with people, I would look up what options were available for treating certain things. So one example is, I had a gentleman come in with, he was getting pains in his muscles. And so I was looking up the possibilities, and it turns out one of the medications he was taking that was for cholesterol causes pain in the muscles when you're having that side effect. So I took him off the medication. He goes, "What am I going to do now?" And I said, "Well, I don't know." So I started researching and looking, okay, what can you do besides this to lower the cholesterol? And I found some things, red rice yeast extract and niacin, and then I put him on a diet, and his cholesterol came down. He felt better. He had more energy. He didn't get muscle cramps anymore. And I was like, wow, that works. It was really cool.
So those aren't things that you typically would learn in medical school or at a hospital, right?
No.
Yeah.
No, really, that's one of the things that surprises me, is that people are surprised. They go to a doctor and the doctor writes them a prescription for a medication. Well, you're going to a medical doctor. If you went to a chiropractor, you could expect to get adjusted. If you went to an acupuncturist, you could expect to get poked full of needles, right? Mm-hmm. So when you go to a medical doctor, what are you going to get? Medicine, right? And that's what we learned, was medicine. And I got a doctorate degree in medicine. Unfortunately, I found later that there were some really good points to it and some not so good points to it. And so that's why I branched out.